How's it going, guys? This is Coach Brad. Back here showing you with a video of spine. I want to explain how the function of the spine works, in particular its relationship to the vertebrae. So if you ask most people who have low back pain, if they had it diagnosed by a physician, physical therapist, what have you, they're probably going to say it's either L4 and L5 vertebrae or L5 and S1. These are the least stable parts of the low back. And what they're referring to in the middle of the pelvis here, this is the sacrum, S1, because we go sacrum 1 and sacrum 2. And then above that, we go 5, 4, 3, 2, 1. So these 1 through 5 lumbar vertebrae, we call them, are the areas that typically get affected. But it seems like the lower you go, the more likely there is to be an injury. Now, what you can see here is all these yellow bundles of fiber. That's supposed to be pairs of nerves that all exit the spinal cord. So at every single vertebrae, you have a left side and a right side nerve exiting, and each of those nerves innervates or feeds into muscles, organs, what have you. Now, all different ones, obviously, because you got a bunch here. So, you can also probably tell that obviously there's discs between each vertebrae, and you can probably tell if you look closely that those yellow nerve bundles, they pair off toward the back of the vertebrae, right? Closer to the back of the body, right? Just in this orientation, what you're looking at is this is the way the leg bones hang in the hip socket when your legs are vertical, and then when you sit, they just pretty much go that way. Cool? Standing, sitting. Okay, here is a close-up of L4, L5 vertebrae. Now, this is a great little model. I love this thing. What they've done is they've put a little sort of a water balloon in the middle, and here you can easily illustrate, because the tops and the bottoms of each vertebrae are flat, you can't have two flat surfaces and expect them to pivot. They won't pivot. So what do? You put a semi-round object between them so you can rock forward, backward, or side to side, or a combination. You can circle. All right, so the disc is this water balloon in this case. And the disc is what enables the vertebrae to have a slight side-to-side movement, right? If I'm holding that bottom one still, you can see it kind of pivots. Here then is a close-up of what would be the spinal cord, which runs, again, closer to the back of the vertebrae, but there's a hole, right? There's a hole for the spinal cord. And then you have these little branches that pair off, right? Doot, 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 doot. Okay, now, watch this. So we know that the spine handles compression. It's what we call axial loading. In other words, the load, when you're holding a weight overhead, it's going to compress the spine vertically along the axis of the spine. So the load is dispersed over all the vertebrae and all the discs, not just two, right? So it's fairly even. So each set of discs and vertebrae only has to handle some of that load, like a small percentage. All right? And when you add compression, here's what sometimes happens. See that little bulge right there? Okay, so this would be a bulge here. And I can't really show you a herniation, but a herniation would be the extreme version of a bulge. Here's the interesting thing. Do you notice where that bulge presses against? See that yellow nerve it's touching? Nerves do not like any type of touch. They hate to be touched. It's extremely painful. All right? So you get extreme pain signals anytime part of that disc, if it bulges, it may press slightly, so you'll get some pain usually. And if it herniates or ruptures, you're going to get extreme pain. Now the structure, in the simplest possible terms, the structure of that disc is like a jelly donut, okay? There's an outer fibrous structure called the annulus, and then inside there's a kind of a jelly-like filling. I don't remember the name, but when you have a disc herniation, that jelly-like substance is what leaks out and presses onto the nerve. Now here's the interesting thing. Almost, I'm not going to say all, I can't say that, but the majority of low back pain comes from forward bending of the spine. When you forward bend the spine, right, here's roughly where that would be, the L4, L5 section. There's the space in the front here is closer together, and the space in the back is wider apart, right? I know it's probably a little hard to see that, but I'm going to just kind of show you with my hands. So forward bending, the front of the vertebrae get closer together here, and the back gets wider apart. And what that does is it typically enables and gives the disc a place to go, to move. All right? So it allows it to squish backwards against the spinal cord. Now, had humans evolved in a different way where maybe the spinal cord was up front here, forward bending of the spine probably would have little to no effect. Back bending of the spine might instead cause the pain. But unfortunately, here we are. All right? The spinal cord and all these nerves are at the back. So forward bending of the spine, hence crunches, sit-ups, sometimes V-ups, Russian twists, which cause the low back to round, and we're adding movement, we're adding vertical compression, and sometimes we're trying to rotate, right, like a Russian twist. This is why those particular movements would aggravate the disc and cause more movement or require more movement of the bones. All right, so that is basically why I don't do those in my training. I think that was basically what I wanted to tell you about that, and just kind of show you what that would look like. Squish, squish. Okay, so knowing that, you want to also avoid forward bending of the spine. If you've already got low back pain, you don't want to piss it off more. So we're going to focus on things like planks, isometric abdominal tension, but there's no movement of the spine. The spine stays within 5 to 10 degrees of movement overall. And again, that's dispersed over all the vertebrae, not just a few. So the pressure would feel a lot more even, and therefore it should put much less loading and therefore less discomfort on your low back. And as we strengthen the muscles around the core, which to some degree helps support the spine, we're going to see some improvement there. All right. Hope that helped make things a little more clear for you. And thanks for watching.